everybody. I'm Trudy Kepsel. I'm the coordinator at the Prince of Peace Mission Outpost Dental Clinic in Burnsville. If we haven't met yet, please come up and say hi. I'd like to meet you. Allow me to introduce Heather Geerts, Master's in Social Work and licensed independent social worker, Director of Clinical Services at Zumbro Valley Health Center in Rochester. Karen Engstrom, registered dental hygienist and Chief Operating Officer of Appletree Dental. And Tracy Lee, Chief Operating Officer of Zumbro Valley Health Center. This session describes a unique collaboration to include oral health, along with pharmacy and primary care in a health home for high-need populations. Since 2012, Zumbro Valley Health Center and Appletree Dental have partnered to serve the ZVHC clients who are also receiving mental, behavioral, and chemical health services. The collaboration to include on-site dental services has provided access to care for nearly 1,700 clients and community members. This patient-centered approach meets the triple aim to improve patient care, patient health outcomes, and lower costs. I want to remind everyone that there is a CE table at the back of the room at the end of the session. And we will also have a question and answer session at the end. We can pass the microphone around so that everyone can hear better. So please welcome our guests.
Good morning. I'm Tracy Lee. As Trudy said, I'm the Chief Operating Officer at Zumbro Valley Health Center. And I'm going to tell you just a little bit about our organization. We're a community mental health center, and we're licensed through the state of Minnesota as a Rule 29. We've been in operation since 1966, and since that time have operated pretty traditionally as a community mental health center, offering services such as psychiatry, therapy. We have community support programs such as case management and ARMS, which is adult rehabilitation mental health services. We also operate a residential treatment facility in our area and the detox center, as well as offering some chemical health services. Up until about 4 or 5 years ago, we continued to operate as a traditional mental health center, but more recently have added some additional services. The first of which was a pharmacy. We have an actual pharmacy within our community health center. And then followed that up with the dental services, which is what we're here to talk to you today about. And lastly, about a year and a half, well, almost 2 years ago now, we added primary care to our facility. So really looking at how do we serve the whole client, how do we look at them, not just from a mental health standpoint or chemical health standpoint, but really looking at the whole individual. And so by bringing in these additional services, we've been able to serve the needs of the whole client. We have about 150 staff in our organization. We operate out of 4 different locations, primarily in Rochester, but also in southeastern Minnesota. Most of our staff operate out of those facilities or out in the community. Just a little bit of patient demographics. We serve approximately 5,000 clients every year. Of those clients, about 89% are publicly funded. And we know that of the publicly funded individuals, those who are on like medical assistance, about 70% have some sort of mental illness. They're either SMI, which is severe mental illness, or SPMI, which is severely and persistently mentally ill. Studies have shown us recently that anybody who's diagnosed with an SMI or SPMI tend to die on average 25 to 30 years sooner than the average population. We've also identified that 1 in 3 of our patients who have a psychiatrist or who receive psychiatric services at Zumbro Valley typically have other services there as well. So they either have a case manager, they may be receiving ARMS services, or they might be receiving chemical health treatment. And then the last note is that it's about 70% of our patients who are seen in psychiatry, we've also identified that they have, in addition to their mental health concern is a comorbid condition such as diabetes, obesity, hypertension, asthma. So this is really what drove us to think about the fact that we need to not only treat an individual's mental illness or chemical dependency, we need to also look at some of these medical conditions that they have, because likely that's contributing to their mental illness as well. So that's just a little bit about Zumbro Valley in a nutshell. I'm going to turn it over to Karen to talk a little bit about Appletree, and then I'll talk more about how we came together. Karen?
Thanks, Tracy. It's really a pleasure to be here today with all of you and with my wonderful partners from Zumbro Valley Health Center to share with you our unique collaboration and partnership, because it really is quite special, and it's really exciting to be able to share with you how it all happened and how it's grown and what it's developed into and what it means for many, many patients in the Rochester community. Appletree Dental is an independent, nonprofit staff model and dental practice founded in 1985. Our mission is to improve the oral health of all people, including those with special access needs and who face barriers to care. Appletree's innovative delivery system, combined with our community collaborative practice model, is really the core for providing proactive, patient-centered dental care that really focuses on prevention and health outcomes. Our nonprofit structure and our model in particular is a unique care delivery system that many of you may have heard of, and it's what really provides ways for us to collaborate with other healthcare entities such as Zumbro Valley Health Center. Our interdisciplinary collaboration that involves all areas of the workforce model, that collaboration with Zumbro Valley Health Center has been able to overcome barriers to dental care while focusing on improved health care, and then also by lowering costs because of that interdisciplinary collaboration and the integrated care. Throughout the 30 years of growth and sustainability, we've expanded our geographic presence not only throughout Minnesota, but most recently in the state of California. Our history also includes independently operated replication programs in Louisiana and North Carolina. We're really happy to be able to operate on an open source, meaningful use electronic health record system that keeps us integrated between all of our centers, including California, and also at all of our community sites. So any of our providers working at those various sites, the entire patient record is integrated. And where do we provide care in Minnesota? Appletree provides dental care at 6 regional centers for dental health, including our center in Rochester, and at 130 community collaborative sites. We have over 200 paid employees who serve low-income children and families in both rural and urban areas. We also serve veterans, adults with disabilities, minorities and new immigrants, mental health patients, and elders living in long-term care facilities. And when we talk about our community collaborative practice model, what does that really mean and how does that work? It means collaborating with community partners to deliver oral health services on site where people live, or where they go to school, or where they receive other health and social services in an integrated care setting like at Zumbro Valley, with the goal of creating a true dental home, which is what we've been able to accomplish so well by partnering with Zumbro Valley and their willingness to be progressive in that thinking. And by having our center in the same area as that collaboration, we're able to use that as a resource as well, and for referrals for those patients maybe being referred from primary care for more of the specialized services such as advanced oral surgery or IV sedation. So it really encompasses a very comprehensive model of care as well as that much needed on-site care for these clients. All right, Tracy will go on to talk a little bit more about how it all started and where we're at today.
Well, I wish I could take credit for this great idea, but I can't. It's actually a little bit of a unique story. I received a cold call from one of our business neighbors asking if we had some conference room space or some space within our facility that they could utilize to set up a dental clinic. And my first thought was, are you kidding me? How do you set up a dental clinic in a community health center? We don't have any of that equipment. And so Kathy explained to me that they have mobile equipment. It's set up in their facility, and they kind of move that around. So they really just need a space, certain area wide, and they need access to water and some other things. And I said, well, we've got some extra conference rooms. I think that we could accommodate that. And so Kathy and I met several times and looked at the space that we had available to determine if it was going to meet their needs, and we did. We thought it would be a great idea to kind of earn a little extra revenue. It wasn't going to be a lot, but if the space was sitting empty anyways, we might as well make some money on it. So in the meantime, we continued to have some discussions as a leadership team at Zumbro Valley about Appletree coming in and kind of how that patient flow was going to go. Were they going to check in at our main customer service area? Would they come in through a separate door? How would all of that work? And through our discussions, really came to think about the fact that this is kind of exciting. We're going to have dental clinic here at Zumbro Valley. And, we have a lot of clients who haven't received dental services in a really long time. Wouldn't this be great if not only was Appletree providing services to their clients here, but if we could get Zumbro Valley clients in to see them as well? So we went back to Appletree and asked them, if they would be willing to see some of the Zumbro Valley patients as well. And after a little bit of thought, they said, yeah, we think that would be a great opportunity for us to serve that underserved population. Kind of in the middle of all that, or amongst our discussions, we also received a letter from one of the local providers in town indicating that they were no longer going to be accepting medical assistance as a form of payment. So for our clients, that was a pretty big deal. We really only had a couple, if not this one provider in town, that our clients would be able to see for dental services. And so the fact that they were no longer going to be accepting them as clients, they really had no place to go. I think the nearest dental office that they could receive services was about an hour and a half away. So we continued our process of coming together, putting together our memorandum of agreement and lease agreement for Appletree. We also put together at that time a business associate agreement so that we could share information about clients freely. We didn't have to receive separate releases of information, and completed that process in October of 2011. So the first clinic was set up in October. They started out, Appletree, coming to Zumbro Valley anywhere between 2 and 4 times a month initially. And by March of 2012, we had increased that to 16 days. The need was huge. And not only were they coming more days, they were also bringing in a whole nother set of equipment. So they had 2 operatories set up in the conference room. We had to find them a different one that was a little bit bigger to accommodate their equipment. And just to give you a couple of numbers here, in October of 2011, they had 2 clinic days with 2 chairs. They served 13 patients and provided 16 different services. 10 of those 13 patients were Zumbro Valley clients. By March of 2012, they had 16 days that they were at Zumbro Valley. They had 26 chairs, so multiple days they had more than 1 chair there. They served 120 patients that month and did 181 services. 44 of those 120 individuals were Zumbro Valley patients, so the need had increased just tremendously. So it was at this time that we started talking with them about having them there on a regular basis, having a permanent dental site at Zumbro Valley. As I mentioned, we had a pharmacy on site. The dental services were going really well. Our clients were finally being able to be seen. A lot of times, a case manager would come with them, gave them a sense of ease in going to the dentist. A lot of them hadn't been there in years, but the fact that they were able to come to Zumbro Valley to receive those services really eased that ability to get those services. So we had conversations about how this might work. We applied for one grant and unfortunately didn't receive it. We put together a plan of doing a pretty extensive build out at Zumbro Valley and ultimately decided that Zumbro Valley really didn't have the funds to do that as a nonprofit, and Appletree had a couple of other projects going on, and they really didn't have the funds to do that extensive build out either. And so we went back to the drawing board and thought, okay, we know we want to continue the relationship, we know we want to have Appletree here, how else can we do this? How else can we make this work? And so what we decided to do was, instead of a complete build out in the area at Zumbro Valley, we were just going to do more of a modified. And so what we did was opened up a space to allow access to the water that they needed. That was pretty important. Sectioned off a conference room so that they could leave their equipment there, it would not be disturbed, but yet we could still use the other half of that room as a conference room if we needed to. So they didn't have to bring the equipment in and out every time they came, which got to be somewhat difficult and costly as they, load and unload the trucks. They got to pay the drivers and the gas and all of that too. And so what we determined was that Appletree had an extra set of mobile equipment that they could bring and leave at Zumbro Valley, and so that's what they did. So we have a permanent site there with temporary equipment, although it's there on a permanent basis, and we're still able to use that conference room if we need to on the days that Appletree's not there. So over the last 4 years, they've served approximately 1,700 individuals there, and of that, 400 were Zumbro Valley. So it's been a really great partnership that we've had with Appletree. We've had some stumbling blocks. There's paperwork that needs to be done and referrals and getting into the clinical system and how does the patient flow work, but we've worked through those issues and have really had a great partnership with Appletree and been able to work through some of those things. So I'm going to turn it over to Heather now. She's going to talk a little bit more about integration in bringing dental into our clinic.
Thank you guys very much for having us here. It's so exciting to be able to talk about this partnership because we have been, as an organization, Zumbro Valley has been so intent on trying to provide that integrated care, and for us to be able to think outside of the box and look to partners that weren't the expected partners. It's just been a wonderful experience, not only for us, but for the clients that we serve. So it's very exciting to be here and talking with all of you. Up on the screen, you'll see a couple of pictures, and this is what Tracy is talking about. This is the permanent site that was set up at Zumbro Valley for the Appletree clients. You can see there's a separate dental sign to show our clients that the services are offered in that room. And then there is the site where clients can receive the services. As you kind of see from that first picture, those are the partitions that we put up. So the one side of the room is where we have a nice large conference room. It also then can serve as a check-in for when clients are coming. It's got that multi-purpose use so that the Appletree staff are able to move the tables around and do the check-in, get them seated, ready to go in and see the dentist or the hygienist when they are ready to do that. So just to give you a little bit more and to kind of a view into what we're working with. So my role is to talk about why integrated care. I think each and every one of us sitting here have heard that term. We work with it every day, but it's really looking at what is it, because there's multiple definitions, there's multiple ways to think of it. And I would love, because you all look so interested out there, to see if any of you have an idea of what integrated care means to you. Just throw some words out. What is integrated care to you? Holistic. multidisciplinary, coordinated, connecting, co-located. Excellent. Every single one of those falls within that definition that our working definition every day. It's trying to bring those multidisciplinary, holistic care into a coordinated effort to provide the best care possible for the clients that we serve. Because each and every one of us is sitting in this room or is in this room because we want to provide for clients. We enter these professions to help people, and the best way to do that we have found is really through those integrated processes. So this is probably one of my favorite slides, and I say that because I'm a clinical person. As they said in the introduction, I'm the director of clinical services, and my CFO gave me a compliment on a PowerPoint slide. Now that's huge. I don't know about in your organization, but when the IT director tells the clinical person, hey, nice job on a slide, this is one of my babies. What we're wanting to point out here, and this is why integration is so important. Why are we moving to where we're moving? And the reason for that is there are so many converging forces now within the service fields that we work in. And what we're really trying to look at is the role of healthcare. As we hear about certified healthcare homes, behavioral healthcare homes, and all of those different kinds of services, those type of centers, those all-in-one kind of centers are becoming more and more pertinent in today's society of care. We also, as Tracy talked about, if you think about the life expectancy, it was very eye-opening for us, and so much of the research is showing and has shown us that as we look at the individuals that we serve, that individuals that have this severe and persistent mental illness, the fact that their life expectancy is less than someone who doesn't have a mental illness. Why is that, and what are the preventative factors that we can work with and provide care for? As we look at healthcare reform, it affects each and every one of us every day. And that contributes to why we need to come together as a unified team to provide these services. We have the outside forces of population health, and this has been huge in the mental health world for us, and I'm not sure in the dental world, but coming from the medical world, population health is something that is thought about. It's common nature to think about how do we serve that entire population other than just the people coming in for service to us. And this is something new for us. How do we reach out to that general population? How do we think about what the needs might be? And that is really tied into some of the healthcare reform. And then looking at that team-based care. I think that we know that as we can communicate and collaborate and coordinate, we are able to provide a top-notch service to the clients that we serve. So if you look at this entire picture, it really supports these integrated care models. And this has really helped us serve in the foundation of developing these relationships with our valued partners such as Appletree. So as I kind of talked about, and as Tracy mentioned, comorbidity is becoming more and more prevalent. You heard her give you some statistics regarding individuals that have a mental illness that also have asthma, high cholesterol, high blood pressure, obesity, these different pieces. The other thing that we're finding out is that so many of these individuals haven't received dental care, preventative care in 20 plus years. And the lack of that also leads to the decline in their physical health, and it adds to these comorbid problems. And so really what we are trying to do is take this integrated approach of care and try to put all of the models together so that we can improve those clinical outcomes for the individuals that we serve, and especially targeting the populations that are part and integral to the missions of our two organizations. It's been such a natural fit for our two organizations. We both really work with the underserved and the uninsured kind of populations, and so it was a natural fit for us to come together and really try to provide that coordinated care in those areas. As I talked about, there's been some research, and I'm not going to bore you with research because it's right before lunch, and I know that we don't need a lot of numbers and that. But what I do want to say is you may have heard of a couple studies. One was done through the Wilder Foundation, and that's the one that had shown that when looking at life expectancy, that you will see individuals that have that severe and persistent mental illness having a lower life expectancy. Another very pertinent issue or study that really supported the need for integration was the ACEs study. And that really looking at adverse childhood traumatic events and the impact that that had on their health later on. And when I say health, I'm talking physical health, I'm talking mental health, I'm talking the use of chemicals and the chemical dependency concerns, and that individuals who had engaged or had experienced an adverse childhood experience were much more likely to have decreased life expectancy, have more comorbid conditions, have a chemical health diagnosis, have a mental health diagnosis. So for us, what that really led us to see is that if we can provide that coordinated and integrated approach to care at a younger age, at an earlier preventative stage, that then also may have ramifications as that person, as that child grows older and enters in. Maybe we can prevent, that mental, that troubles from the mental illness. Maybe it can prevent the chemical dependency concern that they have. Maybe it can prevent a heart attack. Maybe it can prevent, all of those other factors. So that was really one of the key kind of factors for us. The other thing that played into this, and really as we talk about integrated care, when you work with the population that we work with, trust is huge. Trust is a major, major factor. And we had so many clients that trusted Zumbro Valley as their center of care. And so they would come to us, they would come receive services, and we could make a referral. We could say, we really think you should see a dentist. We could say, we really think you should see a primary care provider. And they would look at us and they would nod because they don't, they want to please us and they don't want us to be upset. And they would say, sure, yep, make that referral. And so we would make the referral, and then they never showed. And then they'd come back and say, I know, but something came up and I just didn't make it, or my car didn't start, or overslept, and it just never happened. And so that really led us to the foundation of the model of care that we are adopting. And the reason that the partnership with Appletree was so integral, we were able to provide the service on site. We were able to have the clients come to the place that they are safe, that they feel safe. They can check in, walk through the same door that they walk in to see their doctor, to see their therapist, to see their case manager, and they could see their dentist. It's what led us to provide that primary care service. Same exact thing. They could receive preventative care by walking in the same door that they had walked in to see their therapist that they trust, and then they could get a physical. They could get a dental cleaning, and then they could talk with their case manager. And so that trust and that foundation of trust is what has really been, I think, one of the key pieces to the success of our integrated care model. And I think is really going to allow us to continue to provide that coordinated effort forward. So if you can't tell, I'm a proponent of integrated care. And I do believe that it is the gold standard at which we all need to practice in this day and age. We really need to reach out and look at whether it's their medical home, whether it's their primary care clinic, whether it's a community mental health center, we need to be constantly striving for encompassing that continuum of care, that 360 view of a client. It's not just working with the mental health. It's not just working with their, oral health. It's not just working with their chemical health. It's not just working with their physical health. We need to, as providers, be able to take that full 360 view and say, how can we as a team help you? And that, I think, is where, if you want to provide that top-notch service in the future, is where you need to be. And I think that we have seen the evidence for that in this trial, this this interaction that we've entered into, which has been relatively recent for us, but has proven to be extremely important and extremely successful in the care that we provide to our clients. So you've heard about the models of care, and I just kind of want to talk a little bit about that, because as we talk about integrated care, there's multiple ways you can provide that. It's not a one-stop shop. It's, this is what works for us, this is what works for our partners, but there are multiple ways in which you can provide integrated care. And there are several different kind of models that are out in the communities in which we live and work. One is the in-house model, and that's where you have one agency in charge of all the services. This is a model that we adopted when we looked at our primary care services. We could have collaborated with one of the primary care providers in our, we're in Rochester, Minnesota. We could have teamed with Olmsted Medical Center, Mayo Clinic. I mean, and brought one of their providers in. That would have been an option. For us, and in talking with our community partners for the primary care aspect, it really made sense to provide that in-house. So that's one model. Another model is the co-located model. And I heard I remember that was something, as you talked about integrated care, you thought about co-location. And that's a very effective model because it's where you have more than one agency that's providing services out of one location. And that's the model that we've adopted with our partners, Appletree Dental, Genoa, QOL Pharmacy. And so those services really, it made more sense in looking at the way that we could provide service and to provide the best service to team and to co-locate those services. So in those areas, we decided to go with the co-location model. And then the third model is collaboration with clinics. And that's really where you have, an agreement to, collaborate back and forth and to work with that. So those are kind of the three models. And I just kind of wanted to give you that example of, you don't have to, for us, it's not that we decided we have to be in-house for everything. It's not, a one-stop shop. It's not going to be the same in every area. So I think it's very possible, and I think we're an example of where you can utilize multiple models of care depending on the service that you need and still provide that comprehensive 360 service to the clients that we serve. And really, this has led to this. This is our integrated multidisciplinary model of care. We have, as you look in the top left, that's our entryway. That's when you walk into the clinic. You walk into that door, whatever service you're going to. It shows our traditional model of, outpatient psychotherapy, psychiatry, case management, skills services. Over on the top right, that's our primary care clinic. It is in the same building, and that's our nurse sitting there. We have we have a lab on site where we can run different kind of, tests. Then you see our pharmacy. The wonderful thing about our pharmacy is they've been willing to team with us. We had a meeting, and I remember this, I don't remember when it was, but I'm thinking back, it was a couple years ago, and we were trying to say, how can, the pharmacy came to us and said, hey, we know you guys have dental services here. So we sat down with the Appletree staff, the pharmacy staff, and they said, what are the major things that you would, what are the major, drugs that you would be prescribing? Can we keep those in stock so that if you have a client that needs, that has an abscess and needs to come down for an antibiotic, what might you be prescribing? We'll have that on site so that you can prescribe that drug. They can come down and pick it up, and they can leave here with their medication after receiving service. The pharmacy wasn't just there to support our psychiatry department. They were also willing to support Appletree and the dental services. As we brought primary care on, did the same thing, sat down and said, what are the, what medications do you need us to be stocking in order to support the primary care clinic? So we all worked together to be able to, support that client and to be able to have the resources on site that they might need. And then you see our dental services down in the lower the right-hand corner of the screen. And they're coming in. I think, one of the things that has been huge for us, and I want to share a couple examples of how integrated care has been successful. We had a client come in. He was a case management client, had worked with us for, I want to say 10 plus years. Had not received dental services in 20 years, had not seen a dentist, had not had his mouth looked at in 20 years. He was petrified to go to a dentist. And so the case manager said, hey, how about you go to Appletree? It's right here. You don't have to go anywhere else. And you know what? If you want to, I can come down there with you. I can sit with you. You'll be here. Gentleman was very nervous and wasn't sure. And, he said, let's just walk down and look at the clinic. Let's just go, why don't you just look at the space? They're here today. You don't have to do anything. You can meet the staff. You can talk. You can just look at it. They did that. It was a nice, warm handoff of, hi, I'm so-and-so. Yes, we could, these are some of the things we could help you with. That day, he scheduled an appointment. The next time that the mobile clinic was there, this was before our permanent site, they came down. The gentleman who had not received services in 20 years, his case manager walked down. He received a cleaning. They were able to set up a treatment plan, and he continues to receive the preventative care there. That is, to me, that speaks mountains about integrated care and the benefit of it. Another example of where our teams work together is that we had a client that was in our residential treatment program. And they were complaining of jaw pain. And they had asked if they could go to the emergency room. And as we think about total cost of care and the amount of the costs that we are experiencing in healthcare, nationwide right now, was that really something that needed to be seen in the emergency room? So we were able to utilize and get an appointment set up at our primary care office. And we were able to get the client to agree to go see a primary care provider to see whether or not it was truly an emergent issue. And if need be, yep, they could send him to the ER if that was necessary. Got over there. Wasn't an emergent issue, but they just really couldn't tell what the source of the pain was. So the dental clinic happened to be there that day. Our nurse walked him over to the dental clinic. They were able to work him in, get him seen that day. What happened is he had an abscess. They were able to pull the tooth, get him some antibiotics, and he was feeling better within 24 hours. And that is... to us, that is why we're doing what we do every day. That is where we prevented an emergency room visit. We were able to help a client with a problem that he thought was medical, but it wasn't. That he was thinking that he had broke his jaw or he had something going on. Wasn't that. And we were able to support him within one organization because we have these partnerships built and we have this foundation of integrated care on site. So that is I think, reason that we wanted to talk with you today, and we were excited to be invited because I think there's really exciting things happening right now. We are at a stage where we do need to look for the gold standard. We do need to reach and think outside of the box. Hannah, if you can go all the way to the end, there's a wonderful slide, and I have to share this with you. We had some other things we were going to talk about, but I think you got the gist of what we were going to talk about. Right? Oh, that's all right. Too much. We got excited. So continue to innovate. I think this is to me just the epitome of kind of where we are right now. But it says this really is an innovative approach. But I'm afraid we can't consider it because it's never been done before. Right? Okay. I'm lucky to be supported by a CEO that doesn't think that way. Appletree is lucky to be supported by a CEO who doesn't think that way. And because of that, we have created an amazing avenue for the clients that we serve to receive services. And I encourage you all to continue to innovate. I think it's great if something's never been done before, because that means that we have the opportunity to do whatever we want. So thank you very much, and we would love to take any questions that you might have.